So we are recording the session, and it's for anyone that can't make it that wants a copy. We don't publish it any wider than that, but just to our PPGs. So what we're going to do today is I'm going to give you a really brief update as part of the ICB that Sue would normally do. Bish is then going to come and talk about reinvigorating PPGs. I know it's been a really hot topic for us over the last 2 years, really. So we've got some exciting things to share. Hopefully you'll be just as excited to hear about it as we've been. We've got Melanie that's going to talk us through the winter campaign. And then at the end, we're going to do an end of year health quiz, which Bish did with me, and I did quite well. I'm glad to say. So I'm going to be testing other colleagues on here as well. So we'll come on to that in a bit, but you did receive an email asking you to bring a piece of paper and a pen. If for any reason you can't turn your camera on or anything, that is fine, or you don't have paper and a pen, you can write it in the chat box. And we'll do any other business as well at the end. And we've also got dates for the following 12 months PPGs as well. So I'm just going to give you quite a brief update on where we are at the moment then. So the first thing I wanted to let you know about, and hello to those that have just joined us as well. Got a few more people in now. If you could just put in the chat box who you are and where you're from. Alan's just saying can't get Bijou's screen up. I don't really know what that means. Alan, are you okay, Alan?
Oh, Joe, I can't get his screen.
No, he's just stopped sharing. So you won't be able to see it at the minute he's stopped. So, and that's because I do want to share with something with you online. But first of all, I just wanted to talk through the strike action. So you may have heard on the news, particularly today, that nurses are going on strike today. So locally across Leicestershire and Rutland, it doesn't actually affect us locally. And that is because they didn't reach the threshold for nurses to take part across Leicestershire and Rutland. So you won't see any changes there for us. There is, however, another strike that's going to be taking place with ambulances, and that starts on the 21st, which is next Wednesday. And I believe it's also the 28th. So that does affect us and does include Leicestershire and Rutland. So what that means is that only category 1 calls will be responded to on those dates. We are working on the actions that we're going to take for any other calls, so category 2 and category 3 calls. So our system is looking at how we're going to limit the impact of that. But I just wanted to let you know, just so you're up to date on the local situation. You don't need to do anything that you wouldn't already do, but if you do need to pass any information on, then you can pass that on. Secondly, I also wanted to share with you Leicestershire Partnership Trust, who deliver a lot of our mental health services, have produced a book, and I don't think we've shared it here, and I wanted to just share it with you here because it's really good. It's on their website, so hopefully you can see that, and it's called the Mental Health and Wellbeing Support. It is a booklet, it is downloadable, and you'll see there's lots of different languages that are available as well. There's also information on the crisis cafes, so those are the cafes that you can drop into if you want to have a bit of a space to chill out or have a chat with others, have a cup of tea, and information's about where they are. There's links through to see more information. And what's local to your area as well is on this website. So the website's really good. There's loads of information on here and how to get help in neighbourhoods too. So I would encourage you to have a look. I've got another sorry, I think if I share this, you're not going to see it, which is what it actually looks like. And it's this. So you'll see this is the first one that I've just shown. You know, there's so much useful information here, whether, you know, and it's other things as well, whether your mental health situation is urgent or not, whether it's an emergency, and what to do in all different situations. There's a phone number there. You know, if it's a crisis situation, crisis cafes are on there, as I've just mentioned, and other organisations that we've partnered with as well, that's offering all sorts of support for mental health. and other support. So lots and lots of information, health for kids in there and so on. So again, if you over the Christmas period, if you need to share any of that, then I would definitely look at that website and share that, because that's where you can go to get all that information. Thirdly, just wanted to let you know that our Voluntary Community and Social Enterprise Alliance, which some of you have now joined, was launched. So this is where, and again, I think most of you will know about this now, but this is where you can go on as a voluntary or community sector organisation and have a look and see what's local to you. We've got 99 organisations on there now. So we're building that up. We're trying to, Kirsty and I have been trying to get to over 100 all week. We're just not quite, we don't know why we haven't managed, because we were getting 1 or 2 organisations join every day. But they're coming on all the time. You can search the directory locally. So if you wanted, say, to look up Charnwood or Loughborough, you can type in there and see what's local to you. You do need a username and password to get in. But once you've set that up, if anybody's asking you for any local groups, you can have a look on there and see what's there. Or you can search by particular service or community. So you could type in mental health, you could type in diabetes. There's lots of things you could type in and see what's on there. So you will get a copy of this presentation, and I can see Alan's asking for the link to those booklets. So we'll make sure you've got those as well before after the meeting. So that is all I want to share at this point on the Integrated Care Board, and I'm going to pass over to Biz, who's going to update you on some activity that we've been talking to practice managers about. Over to you, Biz.
Sorry, I just realised I was on mute. So hi everyone. Yep. So I'm going to talk a bit about the where we are with sort of the, I guess, the reignition of PPGs, but also the engagement that's ongoing with practice managers and where we currently are with them. Now, Sue has been doing quite a bit of work with practice managers across LLR. And she's made some leeway in the fact that they are more sort of engaged, they are more willing, they're more supportive really in trying to get, you know, PPGs more sort of aligned with them and just generally the whole community. So I'm just going to share my screen, sorry, whilst still there. Can everyone see that first of all?
Yes.
Yeah.
Okay, brilliant. So just a bit of background of what you know. So this is some of the key things that you've said as a patient participation group, but also some of the things that practice managers have said. And there's quite a few common themes around this, such as, you know, is there something we can do in the lines of a recruitment campaign? How can we get more sort of diverse PPGs? If you think about culture, faith, religion, and also age. There was a lot of sort of chat about how we can align with PPG groups in the same PCM. So a lot of you were saying the same thing, and that includes the practice managers side as well. So we thought about this and we thought, well, what can we do to make this work really? I know there's campaigns that have happened in the past and haven't really been that successful. So from then and now, I guess the experiences we've had, what we're looking to do is, and this is something that we really need your sort of help and input on, is a volunteer campaign. So instead of just purely focusing on the PPG angle, is if we use the word volunteer, any sort of content, any sort of promotion, it will hopefully encourage people to get involved with local primary care services. And again, from sort of our working days, we know this has been effective with groups like the Public and Patient Involvement Assurance Group, also known as the PPIAG, and also an online citizens panel, which we've got over 1,000 members. Now, what we felt will be...
Just before you carry on, you're sharing the wrong view of the presentation.
Oh, okay. Okay.
Because this has got the next slides on it, so it's making the other one really small.
Right, okay.
Sorry to put in.
That's all right.
It's looking a bit confusing, that was all.
Yeah, sorry. Right. That better?
Great.
That's better.
Sorry about that. So as I was saying, I think a key word that involves volunteers is the word community. With that image there, you can see there's a lot of buzzwords: caring, committed, dedicated, selfless. And we'll have a look at community sort of focus later on. And for me personally, it's been proven effective in my own sort of work stream, such as the COVID vaccination program, where we've had to reach out to communities through, local community hubs, food banks, etc., so that people are aware basically of what the vaccination was all about, and also that to dispel any myths around it. New message. And I think one of the key things about communities is that there's a real spirit within communities, and also that communities are they're kind of they always build from a solid foundation, and there's that level of trust from the beginning. And also, obviously, I think the other thing is that they're all aligned as well. So the other thing we were looking at is the sort of the reach and power of volunteers. So if we look at a study which is done by Psychology Today, which says that people who volunteer are happy and healthier, and also especially sort of a certain age, those who've donated time throughout their lives, it's improved their physical well-being, and as well as mental well-being, and a longer lifespan. And the other thing is that it expands their perspectives. So volunteering gives you a chance to really sort of meet other volunteers, share experiences, share stories, and it sort of opens up I guess our sort of knowledge on diversity and culture when you do speak to fellow volunteers. The third thing that with the volunteer effect is that you can connect with others and boost health. So volunteers generally are quite passionate about things, and the same causes, similar experiences, and it can bond you. And these connections are important to sort of emotional well-being. And the final thing on volunteers is making an impact to your neighborhood, as in your neighbors. So what you're doing right now as a PPG, and what we're looking to get more people to do, is obviously invest time and help others within their community, within their neighborhood. So people who work and live nearby, it's just giving them a sort of a hand and ensuring that they can thrive. And the other thing about while we talk about PPG groups, by leading with volunteering angle, it will just hopefully broaden interest. That just isn't a regular meeting you attend. And from an NHS perspective, volunteers are crucial for the future of sort of health and social care, as well as our partners with skilled staff. And also, for example, some of our GP practices that are mainly student focused, student volunteering is a great way to show that they are willing, happy to get involved, and also looks good for their sort of future prospects. So how are we looking to do this? So like I said, we've listened to you, and we've listened to the survey that we sent out to practice managers. So we're looking at some engagement activities where we feel that the volunteering angle can make the PPG network flourish more. Now, the first thing there is around marketing agencies. You may read marketing agency and think, dollar signs is going to cost a lot, but I can assure you that's not the case. We've worked with local agencies in the past, and for like a reasonable cost, effective and targeted online search engine optimization, we can reach out to various diverse communities of many age ranges rather, and it does work. For example, you probably recall the mental health consultation we did, and also the Building Better Hospitals. So we used this process, and it was proof successful because we got quite a diverse range of responses from all ages and all different communities. The other thing we're looking to involve is the Voluntary and Community Sector Alliance. So Joe mentioned about there's like over 99, well, there's 99 organizations already signed up. And for yourselves and for practice managers alike, you're not alone. You have got support with these organizations within your own communities. So the Alliance is a great channel to tap into. You know, all those organizations know their communities, talk the language, and there's already a good level of trust and solid relationships in place, like I mentioned before. So then it's yourselves and GP practices. So you guys have access to patients within your practice, you know, effective engagement and, you know, regular communication through, you know, newsletters, emails, Zoom calls, however, it can really make an impact. So we really would need your support on this. And I know you're a willing bunch, so I'm sure you'd happily cooperate. And the other thing we're talking about is our local authorities. I'm talking about our sort of city councils, our district councils, and our church parishes. They also have massive reach with people from all communities and backgrounds. And again, they can be really sort of affecting in you know, getting volunteers to sign up. One of the other things that was mentioned a lot from yourselves and GP practice, it was to have some kind of toolkit that's sort of available. One thing I always say about the toolkit is we are looking to obviously implement one in, but what's important to remember is that the things that we want to put in it is you can adapt it to how you wash with your practice. So that would involve like a conversation with a practice manager. So one of the things we're looking to put in there is, for example, terms of reference. So that's establishing the purpose of the PPG, including roles, responsibilities to reach that common goal. Event organizing, so tips on how to engage with patients through events, whether it's face-to-face, online, or in the future, we're looking at hybrid events. So, you know, you could have virtual copy mornings, something like that, for example. So we'd also include like an agenda planning, which is looking to create sort of a template really for an agenda for every meeting, ensuring they're carried out, you know, in a timely manner, who the speakers are, etc. Then we're looking to have a social media guidance document. So I know we have one sort of within comms and engagement, which we can look at and adapt to for the PPG. And then we've got communications guidance. So this is sort of, you know, how to communicate with your sort of patients, really. So you might do local newsletters, but do people know there's newsletters? Would a text message or a conversation on WhatsApp say, you know, check out the newsletter on the website or you know, on any other platform like Facebook you might use? We looked to have a document for guidance for practice managers, PPG chairs and PPG members, just basically defining how, you know, the roles you take and how you work together can be quite effective. A bit about connecting with your local community. So we talked about the VCSE Alliance, and there'll be a great sort of source to use that because they can, you know, put in the right place with the right people. And then the final thing we were looking to put in there is feedback mechanism. So just basically advice on how you and fellow patients could feedback to not only the PPG, but to your practice. Sometimes I feel like, you know, you've told us you just can't get through to them, but there are other ways we can sort of use to get that across to the GP practice. Right, so I will stop there. And happy to take any questions, comments, views, ideas.
Anybody want to come in? And I suppose I've got a question, which is, you know, this has been something that we've been talking about a lot, and, you know, it's taken us a while to have conversations with practice managers where they've been in the right headspace to do this. So when Beers, you presented this at the Practice Managers Forum the other day, there was over 50 people there, and they were all really keen to hear how we could support them, because they feel like they really want to work with PPGs and make it meaningful. So we're quite excited about this, aren't we, Bish? We just feel like we're at a point finally where we can actually do something with people that are willing and able to focus on that. So it's a real positive. But I suppose from us, we'd really like to know what you think about that, and whether you think we've missed anything. Is there anything that you think maybe wouldn't work? Or Bev, you're on mute, by the way.
Our practice manager has nothing to do with our PPG. How often does that happen?
It is very mixed. There's a lot of we've got some really, really good PPGs out there that are very involved, and then we've got some that aren't at all. So I think it would be useful, and then we've got your details to just have a look and just see where those gaps are, because the more that we create and the more that we do, we're basically offering support to them.
Yeah, the practice manager, the business manager actually runs PPG, which to me is a little bit, so there's no compulsion on practice managers to do this PPG work. Is that correct?
I think that's changing. I really do. I mean, I can't speak for every practice because they are independent businesses, but I really do think the more that we're doing with them, and now that we've got things to help them to do things, that's going to change. But I do think there's some that we're going to have to work with, because they're not all going to be like that, and I think some are going to take some more work. So we can, if that's the situation, I think, Bish, we've got that information, haven't we? How involved some practices are. And
yeah, I was just going to come in, Bev. So Joe, Sue, and I had a meeting with practice managers. There's over like 50 of them, and all of them said they were happy to get involved and sign up to this. So sort of officially, Sue will send out an email to them confirming which ones do want to be involved. But that's where we'll find our gaps, and that's where we will sort of chase those who haven't replied to get an understanding of why. So we are looking to sort of break that barrier down, Bev, rest assured.
I mean, fair do, the practice manager does his best, but it's not quite the same as having the business manager does his best, but it's not quite the same as having your practice manager.
Yeah, but like I said, we'll chase that and look where the gaps are.
Yeah, Malcolm's put in the chat about whether we've got a list of those that want to work with us, and I do believe we have, haven't we, Bish? But I think there's more work to do.
Yeah, there is. We've got, looking at my screen, Paul next.
You mentioned access. Can you hear me?
Yeah, I can hear you.
You mentioned access to patients, but obviously we know the people who live in the community to a degree, but of course we don't know whether they come to our practice or not, and we don't obviously have access to the confidential lists of patients. So contacting patients electronically is impossible. And apart from wandering into the waiting room and seeing who's there, it's a bit hard to contact patients. Yeah,
I totally agree. And that's why on that slide I mentioned about practice managers as well. So they've got a text messaging service that reaches their entire patient base. And so they can send out messages around this. So that's great. Happy to do that. They all do local newsletters. But again, with that, you could put a newsletter on the GP practice website, but who knows it's on there without some kind of nudge. So, that toolkit will help with that. But practice managers, they've got access to their entire patient database. So for all your practices, they could send out a text messaging about this and how they can sort of join up.
Okay. I mean, one thing we do, there is a commercially produced newsletter comes around our villages every month, and we put an article, we write a health article in there every month about a health issue. We've been doing this for about 5 years, so we've covered pretty well everything. And you can get very good information from NHS website, and it's just
Yeah.
then a question of making it into a brief article that can go in, and there's a lot of enthusiasm with the publishers to put it in. So that's one way we try to
Yeah.
do it.
Yeah, no, that's brilliant. I see Alan's also put in the chat box about using apps like Nextdoor to provide
Yeah.
information, which is great. And the other thing I think I put in one of my recent communications is about the ICB website, where we've set up a page purely for the PPG. I'll share the link anyway after, just in case there's a reminder. But we will be putting up resources on there, stories, links of any kind of support that might be useful for you and your local PPG. So, if you do things like newsletters, you can always add that on there as well.
Yeah, you probably need a shotgun approach, because not everyone's on Facebook, not everyone's on WhatsApp, not everybody reads the community voice that comes around. So probably need to do all of them.
Yeah, I agree. And again, with practice managers and using more sort of community organizations, you might need that face-to-face conversation directly first before breaking any of those kind of social media barriers. We need to consider that angle, because it's worked in the past where we've tried to reach out to maybe diverse communities, and sometimes it just involves that element of trust with someone they know very well in their own community.
Yep. Okay, thanks.
Jan?
Hi, just to say I'm linking with a PPG within our PCN who wants to sort of reboot the organisation. And I've put together a pack that I'm going to actually meet with them in January and go through. What I don't want to do is give them information that is going to be repeated in this toolkit. How soon will the toolkit be available? Because obviously if there's a standardized approach that they can then tweak,
Yeah,
that's brilliant. So I don't want to sort of bombard them with information when there's other stuff coming around.
Yeah, I mean, following this meeting and the meeting we had with the practice managers the other day, if we're all sort of agreed and want to get involved, there's a fair bit to do, but we were looking to get it out sort of possibly by the end of January.
Right.
There's a lot of,
Okay.
I mean, there's a lot of content to be had in there. I know.
Yeah.
Did you say you've got your meeting in January as well?
I'm meeting them January the 16th. I've done some work with them already, just sort of via emails, etc. So I think actually the stuff that I will give them will be an okay starting point. But if we've got a toolkit, then I can flag up and say, look, this is coming, and it will be really useful. Then I think that would be the way forward.
What might be handy, Jan, is if you're happy to share it with me, I can look into what you've got and see if it kind of aligns with what we're doing as well. I'm sure it probably will, but at least we can kind of sort of collaborate on that.
Okay, that's fine. I'll get in touch.
Okay,
Thanks.
thank you. Alan?
Hi, I'm not sure whether my audio is working, is it?
Yeah, can hear you fine.
Great. It's interesting because one of the major issues has been, and I know Sue's contacted people, is, and I'm sure Paul would echo it, is there are a number of practices that have never had a PPG for as long as we can remember. It was in the, you've heard all this before, but it was in the contract that the LLR or you required them to have a PPG. We've now got a new chief operating officer in the Northwest, who Laura Norton, who I know I had a meeting with her on Monday, met her for the first time. He's going to push that. So that's good news for the Northwest, providing she can twist enough arms hard enough. And I think that's the issue. As regards to getting members for your PPG practice, I'm sure a lot of people will be saying the same thing. you put messages all over the place. Lots of practice says we've only managed to get 1 in the last 3 years or 2 in the last 3 years. I think there's a difficulty in the times you have PPG meetings. So if it's after work, a lot of people perhaps can't join it till after 6. If you've just come home to work from work, do you really want to join a meeting when you've just got in? I think there are a lot more. What you've done is great. I just think there's a lot more issues.
Yeah, no, thank you for that, Lynn. So take that on board. And I think again, this we talk about the voluntary and community sector a lot in all of this. Yourselves and practice manager have got them to tap into in your local communities and neighborhoods. Now, a lot of them do health workshops anyway. So whether they capture something around their GP insight or support or resource, anything like that, that in a way, if you look at feedback mechanisms, can either go back into you as a PPG, or it could go back to the practice. But as long as a practice has that kind of input, it might not come directly from the PPG, but it's a way into both yourself and the practice. So, I mean, a lot of people might not join PPGs for a number of reasons, such as, it could be language barriers, it could be a disability or anything like that. But those people get a lot of support from the voluntary community sector. And like I said, those face-to-face conversations, they're not recorded, but if we can get people to start taking those insights down, big help for you guys to recognize the sort of reach and diversity of your PPG, and a big one for the practices as well. John next. Is that okay, Alan? Or anything to add?
So, hi, basically, I've just become the chair of our PPG, having not been on the PPG before. So I think the idea of a toolkit is a brilliant thing, especially with coming in from outside, no experience. It'd be really handy to try and have a new start and, yeah, bring it on.
Thank you, John. Appreciate the comments.
John, wait, can I just jump in? Sorry, John, which PPG is that?
Mission Medical Unit.
Oh, lovely. Thank you.
Thank you, John. Appreciate that. Yeah, we're looking forward to creating it. Hopefully, like I said, it will work for you guys, but you can obviously adapt it with your practice how you feel it would fit perfectly.
I think it would be good to have something that basically, even if it's an outline, to say this is what you should be doing, this is the way you should be doing it. I think it would be a really good focus for any PPG group.
Okay.
So I'm looking forward to it.
Cheers, John. Joe?
So thanks, Paige. I've just got a few responses.
You've muted.
Sorry, I was on mute, wasn't I? Sorry. So first of all, you're very welcome, John. Thanks for joining and being part of this. I think I think a real benefit is that you're not alone. We're going to be really supporting as the ICB in the promotion of PPGs with you. So not for you, but with you. So you're going to have that extra promotion. And with regards to the toolkit, there'll be things in there that you don't want to use. There'll be things that you do, and there'll be things that really work well in your local areas. So we're going to be creating a suite of things where you might say, well, that's really useful, but that isn't. Or it might even be that you think, well, that's not quite right. And maybe there's something a little bit more specific that you can do, and that's where you can come in. And I know a lot of you have got some really good ideas already. The practice managers are really keen on seeing a lot of what you've already been doing. So keep those coming in, because we'd love to, with your permission, we would love to include those as examples in the toolkit. So we've had things from you before, like Jan sent some things in, Ramesh, and the carers work that you're doing. These are kinds of things that that they want to see, and they can create their own. So if you're happy and with your permission, we'd love to include that too. So that was all I wanted to say. Thank you, Paige.
Thank you, Joe. Is that another hand, Alan, or is that a legacy hand? You're on mute. Okay, it's a legacy hand. Okay, John.
Yes, just on this question of contact with practice managers and so on. We have our AGM coming up next month, and I have insisted that on the agenda we do have a report from the practice manager to say precisely what value they see the PPG bringing to the practice. That's not something that's happened previously.
Really good idea, and I think it is to put to them what they expect. Absolutely.
Yeah.
Because if you don't have that, then we're going to struggle to get very far at all. We'd be, and then you know what.
No, that's right.
What they expect. So
Yeah.
good idea.
Okay.
Thank you, John. Right, we'll take Ramesh and Bhikkhu and move on. A bit wary of time. So Ramesh.
Yeah, hi. My name is Ramesh. I'm from Highfield Medical Center. Yes, Joe, I'm quite happy for you to share the information like carers awareness, which we've done. In the past, we did the mental health awareness as well. And we have a good relationship with the practice manager at my surgery. And I've not actually had a look at your toolkit properly, but I will have a look at it because obviously I've been in and out of the meeting due to my caring responsibility. But I will say that I've been involved as in terms of involvement for a number of years, and it's very difficult to have a sustainability. We need to show evidence of how beneficial it is to the patients, to the public. Otherwise, they can lose interest, and it's very difficult to get them back on board. So I think just bear that in mind. Thank you.
Yeah, thank you, Ramesh. You said you were sort of popping in and out of the meeting. The toolkit isn't ready yet. We're just sort of passing the idea of a toolkit. If, like I said, if everyone's happy for us to go ahead with it, hopefully by sort of end of January, it will be available.
I'll just come in as well on something that Ramesh has just said. I think, one of the things that I've been really particular about is all very well recruiting new PPG members, but once they're there and they're part of your groups, then what? You've got to have that commitment with what work is happening. Otherwise, you just end up with people ready to go and then not doing anything. So we're factoring that in. We want to be really clear on what the role is, what you can bring, and that's where those examples are really going to illustrate that, because you're the experts locally at what you do, and you come to these meetings every month and you're very dedicated, and we want to be able to showcase what you've been doing. And thanks for the comments, because I know Jan's given her permission for it to be included, and Ramesh as well. But any more, please send them our way, and then we'll make sure they're included. Thank you.
Thank you, Joe. Bhikkhu.
Good morning. I'm from Castle Medical Group, Hospital Azus. We have a fairly active PPG. I'm only just going to suggest that if your PPG is involved in any fundraising activities, it would be very wise to register as a charity, and we can get a lot of money that way. We have a Just Giving page. So whenever some people would like to donate, like somebody passing away and they want to show their respect and donate something to the medical center, they do that through Just Giving page. So we are a registered charity, and that's why our fundraising works very well.
Okay, that's a great point, Bhikkhu. And yeah, I mean, fundraising is an opportunity for you to register as a charity, like Bhikkhu mentioned. We've also got the BCSE Alliance you can register with. So if we've got any opportunities there, which provide funding, you will see sight of that as long as you sign up. So great point. It's definitely an option for your PPGs. Right, John, last question, and we'll move over to Melanie's part.
Right, just a quickie. When I get the 5 on a Friday, I circulate it through as many of the local Facebook pages as I can. But I do have to convert it when I get it to Word or PDF in order to get it onto the Facebook page. So if there's somewhere that could be made more convenient, that would be very helpful.
Yeah,
before, haven't we? That's come up before, and we actually do have the person to ask on it if it's possible. Melanie, do you know if that's possible? It's Melanie's team that produces it.
would have to look into it because it's an email and there's a system that we use to generate that email. So we'll have to look into whether that's a possibility or not. I'm sure there's a way around it.
Thanks, Melanie.
Thank you. So yeah, thanks for everyone's really, really good input, and thanks for contributing to the conversation. So if we carry on with the show, so I believe we have Melanie up next.
You're on mute, Melanie.
There we go. Sorry, I couldn't find my cursor. Okay. As Joe said at the beginning, we don't use Zoom very often. It's more usually Teams. So thank you for the opportunity to come and talk to you again. So I think it was kind of September when I came last time. So it feels like we've been very busy since then, and lots has moved on. So what I wanted to talk to you about was what we're calling our Get in the Know campaign. And I think when I came and spoke to you last time, there was, I think I kind of gave you a little bit of a flavour of what was to come. We hadn't kind of got any kind of final materials or anything. As you will see, kind of things have developed quite well over the last couple of months. So can I have the next slide, Birj? Thank you. So yeah, the Get in the Know campaign launched in November, and the idea behind it is to support people to get the right care as quickly as possible. So we've got a website, so getintheknow.co.uk, and the idea behind that is a single source of information. So either that people can use either when they've got an immediate need, or something that they can kind of learn a little bit more about services in advance, so that when they are kind of unwell, injured, they know kind of how to act and can do that a bit more quickly. So we've been introducing the campaign in stages over the last few weeks. So could I have the next one, please? Oh, I thought that was going to be a different slide. Okay, I'll talk through this bit first. As I said, so the idea is that we'll be kind of raising awareness of the options really when people are unwell or injured. So there's a few kind of key elements to that. So one is about when somebody has got something minor, that they're using 111 online, local pharmacy and the NHS app for advice. There's also going to be a part of it that's talking about how to use GP practices, which I'll come on to in a bit more detail, because I know you'll all be really interested in that part of it particularly. And then also the kind of what to do when it's urgent. So kind of again 111 comes in into play there. So could I have the next one, please? So how we've designed the Get in the Know campaign is that it can be used for lots of different things. So it can be used to talk about services generally, or we can use it to kind of drill down into a specific service in a bit more detail. We've also talked about doing things around particular groups of people, so for example children and young people or carers, and also it can be something we've just literally started to explore is about whether we could do something around particular conditions. So so an example might be kind of conditions that people are going to their GP practice for that actually should be a pharmacy. So eczema is one of those examples that has been mentioned, or we could do it kind of around long-term conditions as well. So it's got quite a lot of uses. So we've just started with the process really. So could I have the next one, please? So this is kind of where we're up to. So we've launched, our kind of what we call our umbrella campaign, which was getting to know about local health services. So that kind of kicked things off, and we launched the website as part of that kind of back in November. We've done something around mental health and wellbeing services. So that's kind of back end of November, early December. How to treat minor ailments was last week, And we've just actually launched today something around the, Christmas and New Year, so kind of opening times, you know, what services are available when. So the things that are coming up then, so in January, we'll be doing something around GP practices. So that includes raising awareness of the practice team, online services, and different kind of appointment options are kind of things that are going to be part of that mix. And then there'll be something after that around urgent care. So could I have the next one, please? So yes, this is just a bit of a screen grab of the website. So if you get the chance, do go and have a look at the website. So there's a whole host of service information there. So that's kind of, we're updating that all the time. So that's kind of where any new parts of the campaign will be. So could I have the next one, please? So yeah, so who we're kind of particularly keen to talk to with this campaign, it is really applicable to everybody, and as the campaign develops, the audience will probably change. But kind of where we kind of started from with this is that there'll be kind of probably three groups really. So one is kind of people that are probably generally in good health and don't need to use services very often, which means they are not as knowledgeable about which ones to use. So that will be kind of our first group. I think there's also then kind of people that are high users of services, so GP practices and probably kind of A&E as well. So it's, because that's kind of represents a large group, again, we need to make sure people are using services in the right way. So that would include parents, people with long-term conditions, so a whole range of people really. And then obviously from I suppose kind of an equity point of view and proximity. So a lot of communities, because they're near to accident and emergency, that's where they go, because that's kind of, often the nearest option for them. So that will be kind of another group that we'll be looking at. So could I have the next one, please? So hopefully the rest of my slides are hopefully fairly visual now. So this is kind of what we launched the campaign with. So this was our umbrella campaign and how we launched the website. So that was kind of kind of mid to end of November. Could I have the next one, please? So these are the key messages really of the campaign overall. So firstly, it's about, for minor ailments, you can treat many of them yourself. But if you do need a bit of extra support, it's using things like 111 online, your pharmacy or the NHS app to help you with that. Secondly is about, using your GP practice if, it's something that you can't manage to treat yourself. And then the third message is about, using, so either clicking or calling 111 for urgent medical problems. The next one, please. So this was our mental health campaign. So that you'll notice there's a bit of a theme running throughout them all. So they've all kind of got a different colour scheme, but kind of a similar look to them. So this was about mental health and wellbeing. Could I have the next one? Sorry, I think you went on to that. That's fine. So the mental health messages are slightly different, but similar, I suppose. So it's kind of about three things really. So what to do if it's urgent. So it's around kind of your GP practice, talking therapies service, and there's a new mental health wellbeing and recovery support service. Then if it's urgent, it's about the central access point and 111 or crisis cafes, and then 999. So it's, I suppose the message really is it's about, there's kind of lots available, in your local communities as well. And the next one, please. So so this was our minor ailments one. So I've talked through the messages around that. So again, just to give you the visuals. And the next one. So this is our kind of hot off the press. We've launched this one today, which is about which services are open over Christmas. So it includes there's a link on the website to the pharmacies that are open, and so hopefully that will give kind of people all the information they need over the next week or so. And then, so the next ones I'm going to show you. So this is the first of our GP practice series. So, so we have kind of involved some practices in developing this, but you're kind of in the privileged group, because we haven't actually written out to all practices yet to say that what's coming and to share the assets with them. So you're getting an early glimpse before your practice managers will at this stage. So the overarching message around practice is that there might be more to your practice than you think, and to get in the know about what's available. And so, as I mentioned earlier, there's going to be 3 then themes that come off that. So could I have the next one? So yeah, so the first one is around GP practice teams, and raising awareness of the fact that there is a whole range of people that you could see at your practice. It doesn't always have to be a GP. And the next one. So yeah, so this is about the different types of consultations, that that there are options on telephone appointments, video, online consultations, and which it's not going to be right for everybody, but it might be what's best, and it might be more convenient for many people. And the next one. So yeah, so this is about kind of online services at practices I suppose that people can use for some of the more routine interactions with practices. So booking appointments online, repeat prescriptions, managing your information, that kind of thing. And plus all of there are kind of things, as well as the national offer, there's also specific services that practices might have themselves. So yeah, so that's the practice bit. What have I got next, Birju? Okay, yeah, so this is the last part of our series. So then again, this will come after the practice campaign, is about kind of what to do around, if you need help urgently. So we might tweak this messaging a little bit. So this is kind of a bit of a flavour of what's to come, but it isn't going to be too far off, really. Okay, so that's what have we got next. So these are the channels that we're going to be using. So we've got a mix of channels. So this is kind of across the piece, really. So some things, so particularly the practice campaign and the minor ailments part, will have probably more paid for activity than the others. There's a wide range of different channels, from kind of using our relationships with kind of stakeholders in our communities to help spread the word, obviously kind of our social media channels, things that we've got kind of control of ourselves, like our website. But as we need to get this out into our communities, we need to kind of do some paid advertising around that. So there's quite a list of advertising that we're going to be doing. So we're also printing some materials. So there'll be a booklet that talks about GP practices in particular, and kind of all the things that I've talked about, which will be translating into a few different languages. What else? The other printed materials we're doing something on minor ailments and something on kind of urgent help as well, which will be just a leaflet, really. So what we will be doing in the next week is writing out to practices in particular to kind of ask them for what kind of quantities of printed materials they would like, because we want to be kind of cost effective with this. Hopefully you'll kind of get notification of that via your practice, or we can kind of arrange for you to get kind of information about that as well, just in case that's useful for you. But so, rather than just printing a load of materials that might get used, we're going to be kind of printing to order. What's next, Birju? Oh yeah, so this is this is my last slide, I think. So as part of the website, we've also got a page that's about what if you want to kind of help promote the campaign. There's a link on this page where there's a drop box where all of the assets that we've produced for the campaign, all the ones that are kind of currently live. So we're continually updating that. So if you do want to kind of help us support that campaign, this is the place to go to get all of the materials that are available. And that's me done. So has anybody got any questions? Sorry, that's quite a lot of slides, so hopefully that was was kind of, you know, fairly straightforward to understand.
Alan, would you like to come in? You're on mute. You're on mute, Alan.
That better? Yes. This is a brilliant setup, but I go back to the premise that we've all said for so long. Not everybody has got access to a computer or a smartphone, or is even vaguely interested. The problem that I raised the other day is this campaign is brilliant, but it's so large, people are not going to plough through it to get what they want to know. It's brilliant. There is so much there, and I'm sure most of us can plough through it, but Joe Public is not going to plough through that lot. There is much too much there.
So yeah, I accept that, and you know, the idea is that, you know, they don't necessarily, yes, we would like people to learn a little bit more about services in advance, but the idea is that people will, you know, when they have a need, they will go to it and find out. If not, what we're promoting is 111, because that will take all of the thinking away from them, and say ideally, you know, 111 online if they do have access to a computer. You know, you know, as I said, we are also printing materials as well, so it's, you know, we're not just relying on you know, kind of having computer access, and as you know, say 111 as well, obviously, you know, it's obviously a phone as well as being online.
Great, thanks, Melanie. And I think you know, we know that you will kind of know some of that and filter some of that to people that are talking to you in practice as well. So hopefully there's just a real big mixture of different methods there that are included. But yeah, there's an awful lot there. Cash, want to come in?
Hi there. I just wanted to add to what Alan was saying. By way of paying a compliment, a few years ago, the CCG printed small booklets, and unfortunately it was city only, I believe. But there was a booklet dropped through every door in the city, and I liked it so much. I gave a couple of hundred of these out over a few months. You know, asked for more, picked them up from St. John's House. And these booklets were a summary form, a quick glance for minor ailments, what to do, who to call, who not to call, and that sort of thing. And I think it was very, very useful. And perhaps that sort of thing, if it was feasible in, you know, post-pandemic, and considering many of us are online, then you know, I welcome that. Yeah.
Cash, I think people were struggling to hear then, but Cash was just talking about a booklet that we printed in the Leicester City CCG a number of years ago, which was printed in different languages. And I remember Cash coming into the office and picking up bundles of different language ones and giving them out, and it was explaining what services to use and when. So Melanie, do you want to come in on that, because it was your project, wasn't it?
Yes, was that, oh gosh, I can't remember which one that was. There's probably a few that we did, but yeah, it is something we've talked.
On the front, I think that Professor Faruqi on the front.
Yeah, I know, it was a self-care booklet. I think he was on the inside cover, I think. Yeah, I remember which one.
My main point is that it gave details of the difference, for example, between a cold and a flu for the layperson. Go ahead.
Yeah, we have talked about that. So we have, well, firstly, we have talked about whether we can kind of, you know, again, put something through people's doors. There was quite a cost involved in that, obviously, you know, printing it, but also, you know, the distribution of that. But it is something we have talked about. So we are kind of looking to see whether we have got the budget to do that again. And yeah, so this time we've kind of shied away from, you know, educating people about the kind of individual illnesses, because there is kind of, you know, sometimes a bit of I suppose because it's difficult as a non-clinician to sometimes kind of work out what's right to do, and quite often, you know, it's like, well, actually, if you're not sure, you know, go to your GP practice. So what we decided was actually it would be better to be promoting the 111 service that would take a lot of that thinking away from people. So we have kind of moved away from that, but you know, there might, as I said earlier, there might be kind of certain conditions where we know people are, you know, one week we might know that there's lots of people going to their GP practice for X, Y, and Z, and you know, we know that they might be better at a pharmacy, for example. So there might be things like that that we do on a condition level. But so it's got, you know, the campaign has got scope to do lots of this. You know, we've just kind of started this really, so there will be a lot more to come, hopefully.
Sorry, Brigitte, would you like to come in?
Yes, thank you. That is why what makes such a good point, Melanie, too, because you're staging the kind of, you're making the steps one after another so that people can follow it. If they have all the information at once, they just aren't able to take it all in. So I think since you are having different stages, it makes it much easier. But I think the idea about leaflets does have a very important role still, because there are plenty of people, like Alan said, who really don't want to do online learning or even reading online. So I think running both will you get the results, but running one alone isn't enough. Sorry, that's all I wanted to say.
Thank you.
It's fine.
Great, thank you. So I think that's all the hands. Thanks ever so much, Melanie, for coming along and talking that through. There's a lot of information there, and really nice to see it first as well as part of the PPG. I haven't seen it yet, so that's really good, and it's coming along. You know, of course, the PPG will be able to support and help, and you're welcome back in the future to let us know how that's going. So thank you.
Thank you.
So we've now coming on to the end of year healthcare quiz. So what we decided, in the spirit of this time of year and the festivities that are going on, we wanted to do a bit of a wrap up for the year. So, you know, you've been involved through all of our meetings. Some of you have been to every single one over the last year, and we're going to test your knowledge. Now, there's no, it doesn't matter if you get it wrong, but we thought it would be good because there's some really useful information in these questions. So I'm going to be the host, and Bij, if you go on to the next slide, just like to tell you how we're going to do it. So we've got 10 questions. They're all multiple choice. So if you have got pieces of paper in front of you, or a piece of paper, if you can write in quite large letters, either an A, B, or a C, then you'll be able to show it to the camera for each answer. If you haven't got a camera on your computer, or if you're on the phone, or if you want to do it another way, then you can write it into the chat box what you think your answer should be. And then we're going to reveal the answer after each question. Then we'd like you to add your total correct answers, and then you can tell us how you did, if that's okay. And again, you can put that in the chat box if not. I'd like Kirsty and Melanie, if you're staying, if you could do it too, that would be great. No pressure. Now, the only problem we've got with this is I can't see all of you while I'm sharing the screen. So, Bij, have we thought that through? I've just suddenly thought I can't see everybody.
Yeah, there is a way, you know, if on your screen,
yeah,
there's like a
view.
Yeah, the view. You can show grid view, and that should show everyone really. But what I'll do, we'll do the question, and then when people do answers, we'll stop share and go to the next question.
Okay,
yeah.
Brilliant. Yeah, that works. Right, so if people are ready, if you are going to use paper, if you can put your camera on, that would be great. So the first question then is, if you or a loved one are in a mental health crisis, which service should you contact in the first instance? So all these questions are A, B, or C is the correct answer. So is it A, call centre access point or CAP? Is it B, call your GP? Or is it C, call NHS 111? So we've stopped sharing. I'm going to do a collective, oops, stopping thing. Paul, I can't see yours, unfortunately. Right. Yeah, okay, so we've got okay. Can't see yours, Alan.
Got one in the
Oh yeah, I
chat.
can see yours.
One in the chat saying B.
Yeah, can see you. I'm just trying to see who I can't see. So people without their camera on, I haven't seen. So if you can write in the chat, I've seen everybody else's, so that's great. Thank you very much. Hopefully everybody's answered. And we've got a mixture of answers. We've got A, B's and C's, and the answer is A. So the central access point can be contacted on that number there. So if you're in a crisis situation, and they will point you in the right direction of what to do at that point, depending on what is needed. So some of you that may have put B, it could be because if your GP is open, sometimes if it's not a crisis, then absolutely it's a GP, but that was a crisis, so that was A. So if you scored A, please score yourself 1 point. Thank you. So question 2 then, if you're ready, is what does PCN stand for? Is it A, Patient Collaboration Network? Is it B, Pharmacy Care Nationwide? Or is it C, Primary Care Network? Oh, look, they've all come up quick then. And you know, brilliant. Thank you. And it looks like, and is there any in the chat? Yes.
C's.
Everybody, that was everybody got that one right.
I'd say so.
That was Primary Care Network, which was C.
Yeah.
So if you've got a C, that's your second point, or you get a point for that. And just a bit of information here then. So just an explanation. I know you all know what they are. But what's really key is that we've got 26 across Leicestershire and Rutland, and there is a website there. So we're going to share this with you. If you click on that website, it will tell you what they all are and which practices they cover as well. And there's lots of information on there. So it's worth having a look if you've not seen it before. So we'll share that with you. Question 3 then is, what are the 4 roles of the integrated care system? This is going to take me a while to read out, so we'll leave this one up for a minute. So is it improving outcomes in population health and healthcare, tackling inequalities in outcomes, experience and access, helping the NHS to support broader social, economic development, and enhancing productivity and value for money? I think the comma's in the wrong place there. B, is it provide outstanding care, collaborate with others, be an excellent employer and be a sustainable organisation? Or is it to deliver high quality care, to support people to live independently at home, to deliver integrated care and to develop sustainable community services? So we'll leave that one up for a second there, Bij, if that's all right, because that's a long one. So anyone is correct, A, B or C? Excellent.
We've got some C's in the chat box.
Yeah, got a bit of a mixture there actually.
Yeah.
Brilliant. Okay.
Tough one.
Mainly C's, got 1 or 2 A's.
Okay.
And what was in the chat box?
A few C's.
Few C's, okay. And that's a tricky one if you ask me, because I think maybe some of our employees wouldn't know the answer to that. Employees might not know the answer to that. And the answer is, it was A. Well, so without me reading all that out again, it was A. And so these goals are for all integrated care systems nationally, and they are adapted at a local level. So we do actually have some of our own things that we add to that as well, but they are the national goals. Okay, that was a tricky one. Question 4. Who of the following will not be able to view your LLR care record? So A, a GP, B, a hospital receptionist, or C, a radiologist. Leave that up for a sec, please. So again, some numbers coming up there. What have we got there? A B, B's, quite a few B's there. PBB. I wonder if this is because we did this recently. B's, any more in the chat other than B's? B's, are they all B's in the chat?
Yeah.
Okay, well, you're all correct because the answer is B. And an explanation is only health and social care staff directly dealing with your care will see your record, and there of course is the website as well, which we'll share with you. So well done, everybody got that right. Question 5 then. In the Ipsos 2022 GP patient survey, so that's the national one that we do, what was the response rate of patients from Leicester, Leicestershire and Rutland? So how many as a percentage of people filled it in, basically? Oh, sorry, Bev, you've got to go, but have a lovely Christmas too. Sorry, you have to leave. See you soon. So is it A, 17%, B, 30%, or C, 46%? So how many, what percentage of the population filled that in when it came through their door? So it is random whether you get that through the post or not. A. Number of A's there, so people think 17%. Quite majority think 17%. Kirsty's got a B.
We've got an A and a B and a C in the chat box.
Okay. It looks like the majority think that it was A.
Okay.
Okay, so
all will be revealed.
And it was B, 30%. Which is quite reassuring. Everyone thought it was 17%. So, and it is tricky, isn't it? Because it comes through the post, it's in English, it's a long survey, but that's 30% of 47,799 patients across Leicestershire, I can't say it, Leicestershire and Rutland that were invited to take part. It is actually in line with the national average though. And there is a website on the bottom of there, although I think there's a website on the bottom of their page, is there?
There is, yeah.
Oh, okay, just can't see it on the screen. So.
Okay. Oh yeah, there is. So which I'll share the slides after. Now we'll have it on.
Thank you. Okay, question 6. What are the 4 focus areas for primary care currently in Leicester, Leicestershire and Rutland? So A is introducing quality improvement, community care, extended hours and redirecting of patients. Another tricky one, this one. B is workforce and leadership, access and infrastructure, quality of care and equity of outcomes, and integrated delivery models. That's if we can understand what the words mean. Or C, develop a primary care forum or network at a system level, improve data flows, prioritise legislative, contractual, commissioning and funding framework, assist systems with integration of primary and urgent care. So some tongue twisters in there. We'll leave that for a second while you have a think what they might be. I don't think I got this one right when we did this.
We've got a B, a C.
We've got a mixture. What if you stop sharing then? I'd like to see what people are putting up. A's, or mixtures. B's, A's, mainly A's and B's, some C's. Kirsty, you can't have both. It's not a trick question. So it looks like, is B the majority there, maybe?
Yeah, I'd say B.
Okay.
Okay, let's see if you're right. Yeah.
It is B. Okay, well done. And I believe Dr. Ray Howe came and did a presentation on this. So if you were at that meeting, you remembered well. I wasn't at that one, so maybe that's why I got it wrong. So question 7. So what is the percentage of overall activity, for example, appointments, medication reviews and referrals for children and young people in primary care? So out of all of the activity that we deliver in primary care, how much of a percentage is for children and young people in total? Is it 25%? 34% or 40%? How many do you think would be children and young people? So we've got a massive A there from Kirsty.
Got a C.
B, C's,
B's.
A's. Oh, majority of A here.
B's.
B. Okay, and C. So we have a mixture of A, B, and C. Looks like majority of A, was it?
Yeah.
And it's C, 40%. So that is a lot, isn't it? If you think that just under half of all our activity we do in primary care is for children and young people. So we've got some websites there about support for children and young people. But I suppose what's really key here and really important is we're here representing all patients in primary care, but actually such a huge amount is children and young people. So of course it needs to be a priority, and it certainly is for us in the RCB. So we've identified it as a priority, and it is really difficult, as we know, to engage families, children and young people in PPGs. But yeah, such a significant number because we are used to focusing on adults. Okay, question 8. What term is described as the routine use of 5 or more medications by the World Health Organization? John's asking if it'll be shared in the minutes. Yes, if you want to run it with your patients, absolutely, and then you can do the same again. A, is it overprescribing? B, is it medicine mismanagement? Or C, is it polypharmacy? Okay, Cash, you've got yours held up. I can't read it. Can you just hold it a bit closer? Oh yeah, got it. C. Brilliant. Oh yeah, quite a few C's there.
C's, I think might be wrong, but we'll see.
C. Is there anyone say anything other than C? There's a B there. Malcolm said B. Okay. And the answer is C, polypharmacy. So we did put the questionnaire, a questionnaire came out a while ago about this term. But around 6.5% of hospital admissions are caused by adverse effects on medicines, and usually people, on more than one medication. 2/3. Oh, I was reading that. You've gone.
Oh, sorry.
2/3 of medicines related hospital admissions are preventable, and between 30 and 50% of medicines prescribed are not taken as intended. So one really hot topic for us, and something that we look at, which is try to reduce the amount of medicines that people are on, because sometimes people take them without having reviews and aren't necessarily needing to be on those. Okay, question 9, we're getting there. So what does VCSE stand for? Such as VCSE Alliance. So is it the Voluntary Committee and Sustainable Enterprise? Is it Voluntary Community and Social Enterprise? Or is it Voluntary Charity and Startups Enterprise? Oh, some of you are really quick then. Ash, you were really quick. Okay, and Brigitte, yeah, B's. Got B there, B. Oh, got an A there, which is, yeah, we've got an A, but mainly B's. Okay, and the answer is it's voluntary, community and social enterprise. And we do sometimes slip in and call it the voluntary and community sector. But it has a crucial role to play in helping us as we go forward in healthcare. And of course, we've got the Alliance, which you are welcome to join as a PPG if you want to. It says we've got over 100. We don't. We have 99 because I've just checked. But again, the website is there as well. And if you do want to add your PPG, then you can do that. Okay, and then the final question is, which 3 healthcare services could you use when you have a minor ailment, such as acne, backache, diarrhea, etc., rather than your GP practice? So we've got A, the NHS app website. You could call NHS 111 or your local pharmacy. B, urgent care and walk-in centres, call 999 or go to A&E. Or C, the minor injuries unit, the local authority adult social care pain management services. So A, B or C, votes in. A, A's across the board, I think. Excellent. So I think you're all correct there. Final slide. And it's A. And so we've just learned that from Melanie's presentation. So of course, that's the link to the website, which is in the presentation as well. But of course, you could be treated more quicker than going to your GP. So that is our quiz. It's a bit of a roundup, but a bit of fun there for the end of the year. So Biz, if you could stop sharing, I'd like to see how people have done, if okay. So first of all, I'm going to say, rather than hold your things up, who got 10 out of 10?
I did.
Well done, Harsha. Does that mean our staff members didn't get 10 out of 10? Well done, Harsha, then. You've taken the floor with that. So that's it, really interesting. I got 9 out of 10 when I did it the other day. So well done. Anyone got 9 out of 10? So we've got Cash and Melanie. Cash and Melanie, well done. Really good going there as well. And then 8 out of 10. Kirsty. And again, put it in the chat if you can't raise your hand. 7 out of 10. Well done, Pauline, Howard, Malcolm,
Brigitte as well.
Well done. Really good scores there. 6 out of 10. Jane, Les. I've got Paul on an 8 there as well.
Jan also got 6.
Excellent. 5 out of 10. None in. Anybody get less than 5 out of 10? John, what did you get, John? 4 out of 10.
Alan?
You're well done there.
Wait, Alan pointed.
4, I'm afraid.
4.
Oh, knowledge,
up to do.
knowledge is power. You can use this quiz anytime.
To be fair, Beige, I thought it was quite hard.
The words were too long.
Get it right, that's worrying.
NHS language.
Well, yeah, that doesn't help, does it? Well done. I know that was a bit of fun, but really well done. Thank you for taking part. It's nice just to see where we've got to. You know, we've done a lot of topics over the last year. We want to continue. I think, you know, I'm pretty confident it's going to develop even further now that we've got this program of work that we're going to be developing, and we really want you to be part of that as we go into the new year. Bish, can you just put up the I'd give you another mince pie, Harsha, for winning there, but it's hard to do virtually, isn't it? But yeah, well done, Harsha, on getting top results on that. So what we've done is we've listed the dates for the PPGs for next year. Now I just want to check with Bish, did we check against bank holidays? I know that it won't actually, will it, because it's Thursdays. If there's any problems with these particular dates that come up, they may change, but this is what we're going to put in the diary, and some of these will be face-to-face as well. So it won't be the January one, but hopefully by the February one we'll be back face-to-face. We may even call additional ones with the development work that we're doing as well, and you know, you can come to those if you want to. You will be invited. Again, we'll circulate these so you can get these in your diary. We are quite interested in flexing the times and the days if we have to. That's absolutely fine. You know, if you'd rather do an afternoon, an evening, a morning, whatever, you know, we're absolutely open to that, or a different day. And so that's all from us. I'm just going to come over to you. So is there anything else anybody would like to mention or pick up, anything that you want to tell us about or share? Kirsty?
There's a few people here that we don't seem to have on our database. So if you don't normally receive emails from us, I'll pop Birge's email address in the chat box, and if you could just contact him, and we'll add you onto our distribution list.
That's brilliant. Thanks, Kirsty. And we're always looking to update that, especially as we're developing with practice managers now as well. Great, thank you.
Could you just email the dates separately?
Yes.
I thought I had written them down properly, but I'm a month short.
Oh yeah, of course. We're going to share this anyway, so that's fine. You'll get that.
Oh, that's fine. Thank you.
I'm going to share the link to the mental health document as well, so you've got that as well if you want.
Yes,
to share
thank you. Yeah.
So I just want to say thank you. You know, you've been here all year. Thank you ever so much for being part of the PPG. We can't run it without you. So really, honestly, you've really helped us, and you've helped us get to where we are. And the fact that we're developing going forward for next year is great news. I know it's been frustrating at times and it's taken us a while to get there, but we're really confident that we've come up with something with you that you've helped shape. So just kind of leaves me to say, you know, have a great break over the Christmas period. Merry Christmas and a Happy New Year. We will see you all in 2023, and yeah, have a really good time with your family and your friends, and hope you all get a nice break, and we'll see you in the new year. So thanks.
Thank you.
Nice to
Merry
see you all. Thanks
Christmas,
for taking
everyone.
part.
Bye.
Thanks.
Bye.
Bye.
Bye. Nice to see you.
Bye.
Bye.